Patricia and Noel Carlos have lived in their family home in Forestville for 44 years. They are in their early 90s and have 10 great-grandchildren. They do not own a car and for the past 10 years have relied solely on community transport run by volunteers to get to appointments in their local area.
It makes us feel that we're still capable of being independent, and fortunately, without EasyLink, we wouldn't be independent. We would have to rely on our children to do it. But I don't want them to be tracking us around for our appointments and shopping when we can spend quality time with them and our grandchildren and great-grandchildren. So EasyLink releases that.
Community transport like EasyLink is an example of what can be done to prevent social isolation in older Australians, especially those who no longer drive and may have special needs or difficulties accessing public transport.
Then they realise that we do offer all these other services to help them get out and about as well. So we can help them get to a hairdresser's appointment or go and visit a friend. We've got shopping trips that go out every fortnight. And with that, social interaction is so important. The same people go out every fortnight and they get to know each other on the bus and spend a couple of hours shopping to get the essential items and then go home again.
Without EasyLink, the Carloses would be at home. Noel has problems with his knees and cannot move around easily. He finds the social outings provided by EasyLink a means to stay connected with people his age.
And not only that, it's the after everyone's done their shopping, we all converge on one table and we fill that up, and then it's coffee and bickies. No, it's good. No, very good.
According to Beyond Blue, 10 to 15% of Australians aged over 65 experience depression. With an ageing population, there are more older Australians who are likely to find themselves living alone, where it's difficult to mix with other people.
People respond in various ways to being on their own. Some are able to cope with it well. Others feel that sense of loss and may become quite down in the dumps and withdrawn and maybe irritable. They vary. People with their personalities vary.
In May this year, Beyond Blue has partnered with the National Health and Medical Research Council to improve detection and effective management of depression among elderly Australians.
Everyone in the community can be a sort of gatekeeper who can take note of their neighbours, take note of whether they seem happy for a start, whether they're getting out, and whether they need a bit of a jolt along or some help. There will be some who need no help because they're that active sort of person who gets into everything. Fine, but it's the ones who are lonely and shy that, or maybe disabled and feel that they're a burden and they don't want to burden anybody else. But we've got to activate them, get them out and involved. And I, as a psychiatrist, see a number of people who, maybe for personality reasons or because they haven't got any family, they do get lonely and sad and depressed, clinically depressed as a result.
Many elderly are prescribed medication when lifestyle changes and community support would be more appropriate.
And I've seen this happen a lot with people who come to me because they are depressed, and we get them involved in a group like that, the Men's Shed, on buses to go and meet with others. And that makes all the difference. They come out of their depression without needing antidepressants.
With the introduction of the NDIS and state government subsidies, community transport like EasyLink is becoming increasingly accessible.
But I'm really hopeful that people will be able to stay living in their own homes because of services like ours as we grow and stay relevant to the community. So I think there's a positive future ahead.
With an ageing population, it is important to increase services for the elderly to maintain their connection with the community. With access to EasyLink, Noel and Patricia Carlos are the lucky ones.
Done.